Mammograms, the best way to find breast cancer early when it's easier to treat. Having regular mammograms can lower the risk of dying from breast cancer. However, some of us are fearful of getting screened. Consultant psychiatrist Dr. Janine Morris is here, and she's weighing in this morning on why that is and how we can wrap our minds around doing something, because as we all know, Nev, it's early detection. It saves lives with breast cancer. Doc, good morning. Thanks for joining us.
Morning, Dr. Morris.
Hi. Morning, everyone.
Yeah, this is something.
How's everyone doing?
Very well, thank you. This is something that you hear about regularly in your practice. Do your clients, your patients talk to you about this?
Yes, definitely. I mean, fear is something that kind of paralyzes us and stops us from doing probably the things that are best for us to do at times. So yes, it is something that I do discuss with patients quite often. And especially during this month of breast cancer awareness, it's something that we speak about a lot.
You would think, and I understand why it doesn't happen, but you would think that the fear of having cancer would be greater than the fear of not knowing whether you have
Exactly.
cancer. You would think so. So how do you get them around that fear? What do you tell them?
Right. So the best thing to allay fear is to educate yourself. So oftentimes when we, read and understand the process of how things work, we realize that there are a lot of myths and cultural superstitions surrounding these things, especially mammograms, because people are scared because the machine squeezes your breast. So is it going to be painful? Some people think that, the actual action of the squeezing causes cancer. And these are genuine fears. And, if you are someone that doesn't like pain, we can imagine that it would be scary, but, it's not that. If you think about it, the pain doesn't last for that long. And the long-term benefits of you having the screening early is beneficial because, we want to catch these things in the early stages so we can treat and preserve life, because that's the ultimate goal at the end of the day.
Doc, you mentioned fears. Yes. One is of the machine and the potential pain of the breast being squeezed. But you also mentioned cultural myths. So one you mentioned is some people think it's the machine caused the cancer. I've never heard that one before. What are some of the others? Let's debunk them this morning.
Right. So let's debunk some of the myths. So some people think that the squeezing actually causes the cancer by causing damage to the breast in the process of the squeezing itself, which is not true. There are some other myths that I've heard before, that there's radiation coming from the machine, but just let me allay your fears that it's a very small amount of radiation. When you look at it, probably we're exposed via cell phones and those types of things more than anything else in terms of the machine. And you're only doing it once.
Let me stick up in there. There's actually a device that is put on you, right? So as to mitigate, right? So
correct.
In the debunk, let's tell them how it really go, because what are you outfitted with? I don't remember the name of the.
Right. So it's actually a device that protects the vital organs from the radiation. It's like a cape, and they also put something around your neck, which protects your thyroid gland from the radiation as well. So, those things are put up in an attempt to mitigate the exposure of other areas to the radiation, just to give you a direct radiation to the breast. Also to say, as I said, it's a minimal amount of radiation. And for those of us who have had mammograms would know that it is not really a very long process, to be honest. Within 10 to 15 minutes, you're out of there. And, the next step is that your radiographer is going to send the images off to the radiologist, and they're going to send it off to your doctor and so on. But definitely, I think that we need to understand that a lot of these cultural superstitions or cultural beliefs have been keeping a lot of women from having mammograms done. And in so doing, we could save more lives. In speaking about mammograms, it is vital, as I said, to ensure that you educate yourself. And it's important to have it done, bottom line.
Yeah.
There's a new way to do it, but I don't want to go there just yet. Are you able to convince most of your clients that no, you really and truly have to do this? Are you able to, at the end of the day, get them to say, all right, doc, I hear you, I understand, I'm going to do it? Are you able to convince most of them?
Right.
And hopefully you can convince all of them, but I suspect that's actually a little much.
Usually after a discussion, I noticed that you were showing some images of the mammogram and so on. Once we have a discussion and I explain how it's done and so on, usually people then will say, okay, I'll go ahead and see how it goes, doc. Some women...
Go ahead.
Some women do have, as I said, a very painful experience, and they might come back and say to me, doc, you never tell me. But apart from that, as I say, no pain, no gain. Sometimes we need to experience a little pain for the greater good. It's just like giving birth, right? You have all this pain, you push, and then at the end of it, you have this wonderful prize, which is your baby. So there's no pain, no gain.
Two other reasons before we talk about this new way to do the mammograms. One is, depending on a woman's position, you say, in society, she may think she may not be able to play her role as well as before she finds out that she has cancer. The other is the reduction in physical attractiveness should they find out they do and they have to remove the breasts. These are real concerns for women.
Definitely, because as you would imagine, again, societal norms, women are sexy because of their shape and, that their curves and the breasts come in there. Not only that, breasts are a part of the act of foreplay and that type of thing. So, it's something that's very concerning in terms of sexuality, and how you relate to your partner if you do have to have a mastectomy, which is a surgical removal of the breast. Additionally, you can get implants and all these wonderful things, but when you have surgery, there's loss of sensation to the areas that are used in the process of foreplay. And these can cause significant distortions in terms of the intimacy between partners,
Dr. Conrad Curlew is a consultant radiologist and managing director of Radiology West Medical Facility in Mobay, say they have a new breast CT screening device. And he says the new machine is a way of imaging the breast. When you lay down or lie down on a table, you acquire the image by putting the breast through an opening on the table. It says the woman lies on the table, the X-ray tube is underneath, and it scans the breast for 7 seconds. 7. Then the woman puts her other breast through the opening, it scans for 7 seconds, and that's it.
Correct.
That must be a much better way to do it than the image that we saw earlier.
It is a much better way, definitely, because there's no compression of the breast. And another benefit is that women that have very dense breasts, because oftentimes for those of us who've actually done mammograms before,
you get an ultrasound after.
Yeah.
Right, exactly. So that takes away the investigations that you would normally have to do. You do the CT and that's it. It gives you a 3-dimensional view. And that definitely is a lot better.
Yep. Dr. Morris, I pray that you will get all your clients to understand how important this is. And I will say at the end here that my mother found out about breast cancer very early. She lost her breast.
Right.
She lived, as an older person, she lived for 21 years after. And it wasn't cancer that killed her.
Yes.
If you get it early, you're going to be fine. You're going to be fine for the most part. And thank you so much.
I'm glad that you highlighted your mom as well. Same with my mom, because she lost both of her breasts, but she's still here with me.
Excellent.
So,
Early detection saves lives, guys.
Definitely.
I don't have a story like Nephril or Doc, but I can tell you, I get mine done. And some people have pain. I don't have pain. I just have discomfort. And it's on a scale of 1 to 10. It's a 3.
Yeah.
Exactly.
You're in and your O's, and that's the peace of mind you get from that is greater than anything else you can.
Brilliant.
So just
God bless you and your family. Say hi to your mom. Say hi to your mom for us.
Will do.
Thank you, Dr.
Take
Morris.
care.
Yeah,
Thanks for having me, guys.
It's our
All the
pleasure.
best.
Consultant psychiatrist, Dr. Janine Morris.
After the break, we meet this year's National Senior Spelling Champion who spelled the word, what is the word, Nate?
It's about 400 letters in it.
So
400 letters. And she never even blinked.
We'll soon come back.
Yeah, right.